webinar?
Hang on. I just have to get us
got it.
streaming on YouTube first, which we just are, and now I can press start webinar. Okay, we're all set.
Okay. Good evening, everybody. Welcome to our January 25th meeting of the Health and Human Services Committee. And we're happy to be joined by our co-chair, Catherine DeLazaro, and our great committee members, in no alphabetical order, just from top to bottom: Audrey Isaacs, Madge Rosenberg, Sarah Lynn, I saw Robert Espierre, and Rich Robbins, who will also be taking minutes. We appreciate that very much. Both topics for this evening are crucial topics. People are very concerned about what they think they know about COVID, and then what they find out about COVID, either through their own experience or things they hear. And everybody seems to be an expert, especially when you're talking to your friends, because if they've had an experience, that's it. And so we're not going to depend on that. We're very fortunate that our dear friend Brad Korn, who's Director of Community Affairs for the Mount Sinai system, has been able to, again, come forward and help us to get an update on COVID and to have our questions answered by experts. And so I'm going to turn to Brad, and if Brad could introduce our esteemed doctors, please.
Well, thank you, Shelley. We're very fortunate in Mount Sinai Health System to have some great doctors who do infectious disease, and I've brought two of our really good ones with us. Dr. Christina Woods covers the Mount Sinai West and Morningside area, which I know you're primarily interested in. And Dr. Kamens does somewhat of a system-wide, but covers Mount Sinai Hospital. Dr. Kamens also has the best backgrounds of anybody on Zoom, I have to say, because I'm on a lot of Zooms with him, and I always have to say he has the best background. So they're both going to speak a little bit about what's going on with the hospital, what's going on with COVID, and then we'll take some questions and answers. So I'm going to leave it to them now and thank them both for coming.
Okay.
Thank you. And thank you for the very kind introduction and for inviting us to join. So yes, Dr. Kamens and I are both infectious disease doctors. We're both board certified in infectious disease for adults. But in addition to being infectious disease doctors, we also serve as epidemiologists for either our hospitals or for the system, as Dr. Kamens does. And on top of that, we also practice infection prevention, which has been particularly topical over the last while. I tell everybody that I have been more popular than I ever imagined, and I would be very happy to give the popularity back. But at the same time, with that comes a responsibility to try to educate and answer questions for people. And you know, one thing I'll say is that as doctors, our agenda when we decided to become doctors was to help people, to make sure that people had the education and the information that they had to keep themselves healthy. And so we feel that we have a responsibility to our communities to make sure that you're getting the information you need to stay healthy. And so we're happy to do seminars like this or you know, Q&As to really get the right information out. And our only agenda is to make sure that you have the right information and the best information to make decisions for yourself and the people you care about. So for the West side, I can say that, you know, we did start seeing COVID numbers picking up in the month of December. They never really went away, but they certainly got better for a while. And that was the beginning of the Omicron wave. And with that, slowly started coming hospitalizations. And then quite quickly, we started seeing the numbers picking up and hospitalizations increasing as well. You know, there have been a lot of conversations about, you know, is somebody there with COVID or because of COVID? And there are some people who we have seen hospitalized who happen to be COVID positive and came for something completely unrelated. But I think the important thing also to note is that we certainly have seen people and are continuing to treat people in our hospital system that are being treated for COVID and presented for COVID. And in many ways, it's a difficult thing as a practitioner to see this again because we do have vaccines available. And a certain amount of this has just been personal choice as to whether or not someone has decided to be vaccinated. There's also been access issues in the past, which is something that we never want to see. We don't want to see any disparities. We want everybody to have equal access to these things. And so it's been very tough to see people coming in and being as sick in some cases as they had been since the beginning. And alarming also, that we're seeing that. Thankfully, what we have also seen, though, is that people who are vaccinated and boosted largely are not coming into our hospital for COVID. There are some people who, again, might have fallen and broken a hip, and we test them and we find that they're COVID positive and they're completely asymptomatic. And that's really what we want to see. We want to see that people are otherwise healthy and feeling well or have no symptoms, and that we're able to care for them for their other medical problems. And I'll let Dr. Kamen speak a little bit to his experience because he's had a bit more of a global experience for our entire health system, which spans Manhattan and some of the boroughs as well.
Yeah, so thank you. And Brad, thank you for that introduction. My background today actually is Rigoletto, so from the Metropolitan Opera. And I have been advising them for their COVID protocols, and it's been great to partner with such a great group. So that said, I think Dr. Woods did a great job talking about the hospitals on the West Side. Just like all the rest of the surges, Brooklyn and Queens, we have hospitals there. We're hit harder again, partly because they just have more pockets of unvaccinated or partially vaccinated folks. Their vaccination rates are definitely lower in those boroughs, right? Probably better than Staten Island, but certainly lower enough compared to Manhattan that they do feel more strain when it comes to these surges. The Mount Sinai Hospital, aside from having more of the immunocompromised population, like people who have bone marrow transplants and solid organ transplants, they're actually, we're seeing very similar things as Mount Sinai West and Mount Sinai Morningside. The good news is, again, the Omicron variant hit a lot of people, and we do know that if you do get infected and you survive, the good news, even unvaccinated, that it does give you some immunity, right? It may not protect you as much for reinfection, but it does give you some immunity to protect you from severe illness if you get infected again. That said, I think, hard to say if we're going to get another variant, but it is, even if we get another variant, it will be the same Omicron, coronavirus. And so hopefully that everybody who's now been vaccinated or even boosted and people who have been previously infected will have some type of immunity that maybe in the fall, we won't see as much of a disruption in our daily lives, right? Like Omicron did. That certainly is the hope. That is the optimistic view, and while I think I am being optimistic, there are also some signals to say that is going to happen. So,
okay. Thank you. I assume you'll be willing to take questions now.
Oh, of
right?
course, yes.
So I'm going to begin. I just want to point out that we have with us our assistant district manager, who's been doing a beautiful job since he started, but for the past few weeks, actually running the office in the absence of our district manager. And he's been so helpful in so many ways, and we, especially to this committee and this activity, so we appreciate so much. And Matthew, if you could cue me in if there are people who are not panelists who are on the screen have questions, if they could indicate it and you could communicate that. I'm going to start with a simple question. I have a number of them that were given to me. How soon after exposure do you get coronavirus? And we're talking about Omicron because I think nearly 100% of what we're dealing with is Omicron.
I'll let Dr. Woods answer that.
Sure. Okay. So actually, the recent numbers out of New York City are not yet that much in terms of, I know we're saying nearly 100% Omicron, but the most recent numbers actually were more like 85% Omicron and 15% Delta. So, important to sort of know that. I actually just looked at that this week because I was preparing a presentation and I was sort of surprised because I thought that it was higher, and certainly within our own health system. We've been doing some of our own genomics, and we've actually seen numbers that are well in the 90s. So that was a bit of a shock for me. Having said that, once you've had an exposure, we recommend that you should get tested about 2 or 3 days after that exposure. Before, it seemed to sort of take a little bit longer for somebody to incubate the virus and to actually start showing symptoms. But with this new variant, it seems to appear a bit faster. So again, we recommend about 2 to 3 days after that exposure to the positive person to get tested. It doesn't necessarily mean you're going to get sick. Again, if you're vaccinated and boosted, you may have some protection, but that would be the right time to at least take your first test. And of course, if that's negative and you develop symptoms sometime thereafter, you should absolutely retest.
Thank you. By the way, my 99% came from news reports. So that's how much you can trust the news reports. That's why we have the experts with us. Robert, would you like to ask a question?
Yeah, hi, Shelley. I get the impression that in New York, we really are learning this and we're beginning to get things right. And I think perhaps that's why what accounts for the numbers, well, they're not plunging, but they are coming down, are they not? But what really worries me a lot is that in the rest of the country, that isn't the case. And what we do know about Americans is that we love to travel. We're the slightest provocation, we're in the air going anywhere. And so I wonder if the doctors feel that this portends anything for the near future, by which I mean the next couple of years, that while we're stabilizing and getting things under control, we're still, have this penchant for flying all over the place.
Yeah.
To places that are not as conscientious as we are and don't give a damn, really.
So that's a really good question. I actually, full disclosure, I'm going to travel in February and March for
There you go.
Right. What I and again, there's several now. There's a lot of data coming out of the CDC now that says, first, it was if you're fully vaccinated, the risk of death or severe illness is really low, in the order of 15 people per 100,000 persons can get severe COVID, right? And out of those, a fifth, so 3 out of 100,000 people are potentially could die from the disease if they're fully vaccinated. Then here comes more data just this week that showed that if you're boosted, it's even more protection. New York City, last time I looked, actually was 85% fully vaccinated among adults, right? So, which is a good 20 points higher than the rest of the country. If you look at it as a whole, was looking at CNN, it was 65% fully vaccinated. So it really depends on where you're going and what activities you're going to do. That said, I've now prepared myself that I will get exposed. I will have a high-risk exposure. I've already had a couple, even riding the train. I have that New York State app that told me, hey, I was within 6 feet of somebody. Now, and I'm also prepared that knowing that I could get infected, right? And that at that point, I'm not as worried because everyone in my household has been fully vaccinated and boosted. And I'm also happy to speak for Dr. Woods. Her boys have now been fully vaccinated, so she's actually a little bit less worried as well. We still have kids who are not vaccinated below 5, but to say the least, though, that it is safe to travel. Now, I still am cautious, right? I still understand. I love the fact that we still have a mask mandate in the state, although a judge turned that down, or at least said it was unconstitutional, whatever. But hopefully the state Department of Health and the governor will fight that. and that we should be able to do a mask mandate still. And again, wearing a mask in when you're doing activities indoors does prevent transmission. But restaurants, again, it depends on how crowded it is, are probably still at high risk. But again, we also look at the number of cases. So the rest of the country, they are behind New York in terms of number of cases, but they will probably see the same thing where it peaks and then it goes down within 4 weeks, right? So I am planning to go to those so-called red states in some part of my travel, and I expect that they will actually be better by the time I start traveling. And then again, I do like to explore the world, and so we're also planning to travel outside the country, abroad. And the one thing I would say is that to look at countries that have a higher level of vaccination, only because while COVID will never go away, it's here to stay, it disrupts the economy, disrupts life in a place where there's a higher rate of vaccination, meaning then restaurants won't be closed or transportation will work, right? So in places where there are lower rates of vaccination, you'll see hospitals that are overrun. And so things are not going as well, and things may get shut down. So
I'm just going to add, just so Dr. Kamens knows, that the appellate court just an hour ago reinstated the mask mandate for the time
good.
being.
I didn't. I'm
So I
glad
just
to
want
see
you to
that.
know that they did appeal, and it's reinstated for the time being. So
Because I think they picked Long Island, right? That's
on purpose,
court.
yes. But I just want to let you know that went down.
I appreciate that. That's good. I wasn't paying attention, but that's good news to hear that we still have our mask
Okay.
mandate until the cases go down, right? So
Yep.
You-
One thing
you-
is also important to note is if you're in a place where there is not a mask mandate, if you wear a better mask, one of those, higher filtering respirators, it will provide you with a little bit more protection. And so, ideally, yes, you would prefer if you're indoors in a crowded area that you're not the only one in a mask, but certainly those masks like those N95s or the KN95s, the KF94s, it's another option to consider. We can't always control for our environment entirely. We can't change the fact that maybe you have family in Mississippi and you have to go there to see them, and they do what they do, and their laws are their laws. But you can at least take those steps to protect yourself, and maybe also make choices about where you eat. Maybe you choose a venue that allows you to eat outdoors, or there are some small concessions we can make to keep ourselves a little safer.
yeah, and there's actually a question as a follow-up to that, right? So do you need to wear eye protection? We do in healthcare, right? When patients who have COVID they don't necessarily wear a mask in their own room. So when we go in, and the eyes are a mucous membrane, but it's really low risk unless you're really close to somebody and they're not wearing a mask and they have COVID and they cough on you and you didn't have eye protection. But in the big scheme of things, I think if everybody was wearing a mask, at least at the minimum, I don't think that eye protection is that important, but it is something that we do in healthcare.
Thank you.
Right.
Madge?
Yes, this might sound weird, but I've heard many people say, these are people who've been vaccinated and boosted, and some of them seniors saying, I wish I would just get it already and then I would have it over with. Now, my two questions are, first of all, if you do get it, does that then make you, and you've had the vaccination, does that make you less apt to ever get it again or near times? And that's the first part.
Okay, so I wouldn't recommend having a COVID party, right? That's like we used to do for chicken pox. But there is data though that if you were vaccinated and got infected, you do get sort of a super immunity. So it does improve your immune system. Here's the caveat though. The Delta and Omicron variant they're not very similar, right? There's a lot of differences in the spike protein, which is the receptor that causes the infection, that we are actually seeing people who just got infected with Delta a few weeks ago, get infected with Omicron, Or potentially we are looking at a case that is potentially the reverse, which then they got Omicron, and as Dr. Wood said, Delta is still around, that they got Delta. Now, the fact that they're vaccinated and boosted definitely decreases their chance of getting really ill, but again, I mean, you can go on with your life thinking that you will get exposed and potentially getting even infected, but I wouldn't seek it out, right? Yeah, so if you wanted to go to a play or a Broadway show or the opera, they have, booster mandates now, requirements, and they make you wear a mask, and so you should go, right? You shouldn't prevent yourself from doing that. I went to a restaurant this Sunday. It wasn't that crowded, but we did go to a restaurant, and again, we wanted to enjoy the time, and so I didn't worry about it as much because I have had my booster. Dr. Woods, anything? Oh, your second question. I'll let Dr. Woods answer.
Same thing. I wouldn't exactly go to lunch with my friend who's COVID positive to get it. But I think there's a little bit of peace of mind with the fact that having been vaccinated and boosted, that your symptoms should really be mild, or possibly you may not have any at all. So hopefully that gives a little bit of comfort that the vaccines weren't just for naught.
My other question is, one of my children and his family had it in March 2020. Are they, and since then they've had all the shots and everything, but that's like the original COVID version. Would that mean that they're still open to getting the Omicron or Delta?
Yes, so they unfortunately could still potentially contract one of these newer variants. But interestingly, and there was a recent publication from the CDC that actually spoke to this, and some of our own virology colleagues who actually have been publishing and researching on this pretty extensively showed that people who had the initial, let's say the original coronavirus, and then actually went on to get vaccinated after, they had extremely highly protective levels of antibodies, which was fascinating to sort of see that bear out. And I think people looked at it and kind of said, well, twisted it to say, it's good to make sure that you're infected. And that's really not the point. The point was that their body was able to withstand the infection, initially produced antibodies to a virus that was pretty severe. And then with the addition of the vaccine, they now have extra protection. So that has been shown scientifically that, they have that. Again, we don't know if that means that if they come across Delta or Omicron, that they'll have no symptoms, but certainly we expect that they'd be very mild.
Okay, Catherine?
Yes, I have so many questions, but I try to restrain myself. Thank you so much for coming and sharing your knowledge with us. It's so helpful. My first question is, when you think about like the challenges that hospitals are facing right now related to COVID, even like secondary impacts of COVID on hospitals, or just in terms of public health, the public health response, what would you say is like the biggest challenge? And if you had like limitless resources that you could spend to address that challenge, what would you do? What needs to be addressed right now that you wish you could do?
So if I had a superpower that says I can do everything I can, I would then have everybody vaccinated who can tolerate the vaccine. Because as we already discussed, right, our hospitals are getting back. But if you can just imagine if you actually had a higher proportion of unvaccinated people in New York City, who would then be a lot sicker and take up all our ICUs, than people who are, knock on wood, getting heart attacks, getting strokes, a broken leg, right? Who actually need the ICUs, can't get there because it's all being used by people with COVID. So that happened to us as well. So there were some procedures where we had to delay and move to a later date because, again, the hospital was crowded for really preventable, right? So if people were just to get vaccinated, so if you can imagine some states where vaccination rate is 50%, a full 50% of the population are actually vulnerable and are game for being admitted to the hospital and even go to the ICU. So it makes everyone else. And then what's also, when people come to the ED, then they get exposed to all the COVID. So not only did you need surgery for your broken leg, then you're around COVID patients and that you could get COVID as well, right? So I think that's my answer to this, and it would be a lot better if we actually were fully vaccinated. I can tell you that Spain and Portugal in the EU, even with the Omicron surge in Europe is going on, Spain and Portugal are looking a lot better because they have more than 90% vaccination rate. So Portugal is the highest, like 98% of people are fully vaccinated, those who qualify. And so even though COVID's still getting people sick, and they are still admitting people with COVID to the hospitals, like really old people like in their 80s, 90s with heart disease, right? But a lot of the young people are protected, so.
And then I don't know if there's any other responses to that question, but Shelley, I have like one practical question too.
Go ahead. I'll just let Dr. Woods answer that your practical question.
So then I don't even know if this is a practical question, but if you're asymptomatic, like if you test positive for COVID and you're asymptomatic, does that mean that there's no harm? Like if someone is high risk for having severe, like if someone has kidney disease or heart disease or these other issues, if they get COVID, but they're symptomatic, should they still be concerned about like effects to systems? Look out for anything, be careful of anything. Like, is there concern? Like if you're not symptomatic, does that mean you're in the clear? If you have other health issues or not?
So that one's a little bit of I guess, a tough question to answer because there's a couple different ways of looking at this. There are thoughts that COVID itself can leave people with some long COVID symptoms that are a result of sort of inflammation that kind of is in the body. And if you have certain medical conditions, that can certainly make those a little bit more challenging. And so unfortunately, even a very mild case of COVID, and in some cases, even asymptomatic cases, have gone on to have long COVID. There's been a lot of conversation about whether or not we're actually seeing that in vaccinated populations. And at least the indications so far from things that I've read seem to be that it's happening a lot less frequently. So the vaccines are providing protection against long COVID. But again, this was all data that pre-existed Omicron. So we're still waiting to see what happens there. I think everybody has to sort of just take a little bit of a pulse of how they're feeling themselves. And again, you don't necessarily need to have COVID as the thing that's going to tip you off from having, chest pain or something else that might be related to your underlying condition already. And I always tell my patients that if you feel something that's not right, rather than kind of downplay it or think that it's not worth mentioning, you have a medical provider that you really should seek information from. And if you're having any difficulty that makes you think that it's really abnormal, or again, if you're having something very obvious, really bad chest pain, difficulty breathing, better to get that checked out by a medical professional than to kind of decide, well, it's just mild COVID and I'm fine and I'm going to sit it out at home. So those would be reasons that I think would be absolutely worth, at a minimum, a phone call to your doctor. And if you can't reach them, seeking out an urgent care center or an ER.
But in general, though, if you're asymptomatic because you were fully vaccinated or boosted, and you don't have any symptoms at all, you could still potentially be contagious. Although there's some data to show that vaccinated people actually are less contagious than unvaccinated people. I think I think we have to take precautions, especially in that group. Number one, they could potentially still be contagious, so they should isolate themselves. Number two, they should still check their own body, right? They know their body better. And as Dr. Wood said, if they have mild symptoms, they should at least reach out to their provider. But for the most part, if you're asymptomatic and you just happen to test positive because you were doing it, because you were going somewhere or have another reason for doing it, at that point, I would say it's good that you don't have symptoms, and you could take at least a sigh of relief, right? And because there's a lot of people are doing that. I don't think Dr. Woods and I, we don't get tested regularly. The only time I got tested is because I was traveling internationally, and that was a requirement. So, yeah.
Yeah.
Thank you.
Shelley, if more questions come after we're done, I can also forward it to Dr. Woods and Kamens and get answers back for you guys if you're looking for it as well.
I certainly don't mind staying a few more minutes. If
No, I understand, but
Yeah.
I also know they have other things on the agenda that they may want to get to. I also appreciate both of your guys' times as well. So that's why there are questions that could come up afterwards, and we're happy to get back to you with that as well.
Agreed.
I have Shelley, I have an observation that I'd like to share, and certainly the doctors who travel around and are familiar with it. So this is the cultural dimension. So, for example, as far as exposure is concerned, as you know, when you go to dinner in Spain, it's a 4-hour thing, and they don't understand if you go to dinner alone for 2 hours. That's not. They can't process that. So you go in groups of 4, 5, 6 people, and you stay. Of course, you go at 10 o'clock at night, 11 o'clock at night, but you stay for dinner.
Mm-hmm.
And you're there engaging, involved, and everyone else in the restaurant is in all of that exposure, all of that time. And that's a culturally specific kind of thing in all of the countries where you have that kind of group dining out behavior. And it's just an observation that how do you modify your behavior that's culturally based as far as exposure is concerned? My answer is that you don't.
You don't, right? Just like for us to tell
There's
everybody
more wine.
over the holidays not to have gatherings, right? It was very difficult to tell people over Thanksgiving and Christmas and New Year's not to gather. So, and it was just around that time where we had our surge. So that's why we saw it.
I mean, if we think about it, like in Japan, in the Koreas, in a large part of Asia, masks are normal and had been normal before this happened during the winter when respiratory viruses are much more common. And yes, there are other reasons for them, but there's a perfect example. Try to take the example of masking outside of an area where it's very traditionally done and apply it to everyone else. And well, we've all seen how that went. So I think it's just a matter of, again, mitigating risk to the best of your ability, figuring out for yourself what you're willing to tolerate in terms of risk, and making it as safe as you can. The things we have at our disposal are the vaccines and masks and a bit of choice as to, how we live our lives and what we do. And I think we also need to understand that everybody's risk calculus is a little bit different, and that might be based on their personality. It might be based on their own underlying medical history. And I think we would all do a little bit better if we were a little bit less judgmental and really just realize that, everybody does have a certain amount of personal free will to do what they want. And yes, we have a responsibility to our neighbors and to the people that we live in our community, because none of us want to live on an island. And for the last while, when we've all been locked up, we've realized that that's not so fun. So we do have a responsibility, but at the same time, I think we have to balance it a little bit with the fact that there will be some people who will be very happy to go out to dinner every night, will not want to wear a mask. And at the end of the day, I don't have the magic powers that somebody asked about. So, the only thing I can do is just give people good advice and hope that they take it.
Yeah.
Okay, Rich?
Yeah, I guess like many other people, I have lots of questions I'd love to ask.
How about one?
And I do want to start out by a slight correction of Dr. Woods. I think we all do want to live on an island, but one that has Broadway theater and restaurants and concerts and a lot.
But someone has to act unless you're going to be the one, right? So someone has to be on there with you.
Yes, one with a few million other people. So I have 3 quick questions I want to ask. One is, you mentioned that 85% of New Yorkers are fully vaxxed and boosted. We also know a lot of the other 15% are, have prior infections. So I'm wondering, who are the people that contributed to this recent surge in the hospitals? Because you think that there's not much fuel out there to keep getting.
So I'll answer that quickly. Actually, they're not boosted, right? Only 15% are unvaccinated among adults. And so that's still a big chunk where Omicron went through pretty much of the entire population, that there's still a chunk of people that were not vaccinated. And then the other group that we're not counting that in that 85% are actually kids. Unfortunately, in this Omicron surge, the highest proportion, or the people who contributed to the new cases, were really young adults, so 18 to 34, and then kids. Unfortunately, it's that we protected kids in the beginning, but now they're no longer staying at home, right? We're sending them out to the community, and among kids, even just 5 to let's just say the 5 to 17-year-olds, we're lucky if we have 50% of them vaccinated. So that's the problem. So there's still, and so the hospitalized actually are unvaccinated, and the people in society that we need to protect, in whom either they're much older with lots of risk factors, or that in whom the vaccine are not very effective because their immune system is weakened. So those are the groups that are still being hospitalized.
And some people are hospitalized again and happen to also test positive, and they're not necessarily affecting the hospital system because of COVID, but they're there with, I don't know, a heart attack or something, and we tested them, test everybody in, and we find that they're positive too. So they're contributing both to the hospitalization and the numbers, although they're not there for COVID itself.
So my two other questions. One is a perfect segue. My parents are getting up there in years. They are in the proverbial island, even though they're not. They're in New Jersey, but they've like completely locked themselves in a house and are scared to see anyone. Are you seeing many elderly people who are boosted still getting serious cases? And is that recommended, or do you think that they could, and many other elderly people who are concerned can more re-enter society?
I've used this analogy: if everybody who meets the criteria for vaccination, meaning anyone older than 5 years old, were vaccinated, right, who don't have a contraindication to get vaccinated, the mortality from this would probably approach seasonal flu. And your elderly parents, because they're vaccinated and boosted, if they have really severe heart disease, where even flu, even though they're vaccinated from the flu, we've actually seen deaths occur. So while the risk is higher as you get older, it really is approaching seasonal flu. There will never be zero deaths from respiratory viruses, right, like flu, but at least with COVID, with vaccination and boosting, I think it's evening it out, right? So pretty much it's almost like getting the flu at that point, where still a higher proportion of older adults will unfortunately go to the hospital and potentially even die from the disease. But I really think, again, they should do baby steps, but I think it's time, when the Omicron variant, when the positivity rate, let's say, goes down below 5%, they can venture out. When in the springtime, when it goes below, in the summer, when it goes below 1%, at that point, yes, they should, and then look at what will happen again in the fall. Because I can tell you the safest time for us was June, July, August of 2020, because everybody else was at home, but our positivity rate was like 0.7%. We practically had to find someone who was positive for COVID in New York City. And we got there in this past summer as well, in 2021. We didn't go down below 1%, but we were close. It was somewhere between 1 and 2%, meaning 1 in 100 people are positive. So again, you do calculate, as Dr. Wood said, you calculate your risk, and you look at how risky is it to be out in the community. But going to the grocery store, right, if they wear an N95, nowadays, if they keep it to 20 minutes, just go in and come out, and especially in an area where everybody's wearing a mask, it's really lower risk. I wouldn't say it's zero, but again, it's something I would tell my mother, and she's 84. So
Okay, Rich, one last quick question, then we're gonna have to, we could go on all night, but
and again, thank you so much for being here. And again, you perfectly segued to my next question, which is, at what point does this become like the common cold or the flu, where people still go about their lives even if they're infected? And we don't screen people to fly into the United States for the flu. We don't ban school teachers from teaching when they have a cold. At what point do we make that transition?
I think some of that's going to be contingent on having access for more of the population for vaccines. So again, we still are waiting for some of the younger children to have access. Now, remember, babies don't get their flu vaccine until they're 6 months old, and we do tolerate that sort of level of risk for them. But a lot of that also has to do with the fact that, we do mitigate sort of the burden of disease in other ways for those babies. And a lot of that is just, their families protecting and everyone around them is vaccinated. And I think that's really what it's going to come down to is, having more access to vaccines for, well, again, it's not a question of access, it's just not yet approved for them. And we're working on that. Hopefully more uptake. I think also as people get infected, there's going to be some amount of natural immunity, and we're going to understand that balance a little bit better, especially with this new variant. And I agree with you. I think it's going to get to a place where we don't lock ourselves away every flu season. And similarly, I think we're going to get there with this, where we're going to realize that with the vaccines, with the treatments that we have, which are getting better as time has gone on, that this is going to be something we're going to be able to manage and live with. I think we're getting close. Honestly, I think we're getting close. And the numbers obviously have to come down. I don't think it's really a logical thing to do when we have rates of 18%. But as those numbers kind of approach more livable numbers, I really do think this is not going to be as disruptive a thing. So.
And it's the term we've seen used a lot in media, right? When it becomes endemic, just like flu is endemic, meaning that it doesn't disrupt our lives, but yearly deaths would be somewhere between 20 to 60,000 a year, as opposed to 800,000, right? When that happens with COVID, then we will stop isolating people. We will stop. And again, to quickly just answer somebody who was really worried about CDC going from 10 to 5 days, we have to move forward somehow, right? Again, it probably is somewhere in between. I think 5 days may be too short, but again, that's my personal opinion. But 10 days was too long. It was really hindering life from moving on. So at this point, if you're unvaccinated, I don't know what else to tell you. But in with all the data that's available, if you're fully vaccinated or boosted, really. The risks, again, going to 5 days, while there's some disadvantages to it, I think it's fine. It's really our way of moving forward with life, right? So
and somebody just briefly keeps asking a question about incubation, so I'll just take 2 seconds to answer that. So with Omicron, we think it's, again, day 2 to 3 after exposure. With Delta, we said day 5. And so I hope that helps to answer your question. There's a difference of a few days there. And for the people who are talking to vaccine skeptics and don't know what to tell them, I don't know that I really have a perfect answer, although, sometimes a conversation around things like people who take vitamins, those are not FDA approved. So you'd be surprised how many people don't know that. And when you say that to them, why aren't you taking it? Well, it's not even FDA approved. Well, do you take vitamins? I actually had a friend who was afraid to get it because she didn't want to put anything foreign in her body. And it turns out she did Botox pretty regularly. And I said, you're actually literally putting a toxin in your head. So why would you not get a vaccine? And then she went and got it. So, sometimes it's a matter of kind of knowing your audience a little bit. And unfortunately, there's going to be somebody who's going to just really oppose it and give you 15 why. And I don't know that they're really convinced by their reasons themselves. It may just be, I don't want to do it because I don't want someone to tell me to do it. And the only thing I can say is it's best to just have an open-ended conversation and understand that there are going to be a certain amount of people who you're just not going to be able to convince. And sometimes you have to leave it there.
Well, thank you so very much. First, Brad Korn for arranging it, and Dr. Wood and Dr. Kamens It's been so informative and so helpful to us, and we really appreciate it. Thank you so much.
Take care. See you guys soon. Anytime you need something,
Okay.
let me know.
You're
Okay.
wonderful. Thank you. Thank you so much.
Stay healthy, everyone.
Okay. So about a month ago, looking towards our January meeting, I had another agenda for our CERT team, our local community emergency response team. And that was, it was winter time and there are always fire issues. And then there was a major fire at Wise Towers. 100 firemen, 7 people had to go to the hospital. It was a horrible, horrible situation. And then tragically, not far after, in one of the urban renewal brownstones, an 89-year-old veteran using his space heater for things in his house. The space heater, the fire from it went to his bed, and there was a major fire there for him. And the smoke and the flames and everything spread, and of all people, to the apartment of Cynthia Tibbs, who's not only someone's a beloved member of the community, but a tenant association president for that area. And we were so worried. Thank God she's doing well. I pretty much, she knows she's on the call tonight, and we're so happy you're okay. And wish you only good things. And there was also a fire at Park 79, a hotel on 79th Street. And I heard about 1 or 2 other smaller fires. So I said, we have to have fire safety as a #1 priority and to educate the community. Having done these presentations from CERT, where we only do a part of it as fire, almost every time, 99% of the people don't have the answer to the basic questions. Like, what would I do if there was a fire in my apartment? What would I do if there's a fire next door? And so many other things. And over the past few weeks, I've asked people. I was also up in the Bronx at the Bronx Fire Recovery Center. And people who were there from different agencies, they didn't have the answers. They were surprised about this and that. And it's not because people are ignorant, but because we don't educate people enough. And if they were educated 20 years ago about it, they may not have a clear idea now. Like to also be thankful we have with our common Quinones from Douglas House's Tenant Association President, and Reverend James J. Payne, a dear minister from the community, and a number of other people who have joined us, and many participants from the community at large, people who are concerned tonight. And we'd like to also thank Rosalvo Rodriguez from Gail Brewer's office, who spread the good word, and to Matthew, who helped facilitate. So without further ado, I want to tell you that there's a wonderful person at the fire safety unit, Sandra Sanchez, who's always helpful to us, and she's joined us tonight and brought to us from the unit Captain Delegati. And Captain Delegati is the FDMY safety unit captain. And you can't miss him because he's there, and the FDMY Fire Safety Education Unit is screaming out at us and saying, we're here and we want to inform you and help you. So Captain, we welcome you and thank you for joining us tonight to help us understand more.
Thank you. Right now, I'm on hiatus from the fire safety education. I'm actually back in the field. But you know something, unfortunately, in the past few weeks, we've been having a lot of things going on. Our department, police department, a lot of things going on. It's been a bad month. And our phone is ringing off the hook. So are the emails. They have to basically all hands on deck. All hands on deck to teach about fire safety. I mean, we should be doing this all year round. We should get phone calls all the time. But unfortunately, during a tragedy, that's what happens. And, right now, like I said, I'm out in the field, but I'd be more than happy to talk to everybody about fire safety. There's a lot of questions out there. What should I do? Okay, we make suggestions. Hopefully it'll work out for you. Just like, basically I have a panel full of doctors on in front of me on this screen over here. And there's a lot of questions asked and a lot of things, we're not sure of, because everything is different. Okay, like I said, we can make suggestions, how to keep yourself safe. But it all starts with prevention. It all starts with prevention. How not to get yourself in that predicament in the first place. When we talk about prevention, we can talk about prevention with maybe cooking safety, candle safety. You brought up something, space heaters. Unfortunately, people are cold and they have to resort to space heaters. But if you do use a space heater, make sure, because it is as small as it is, it's an appliance and it still has to be plugged directly into a wall. Okay, it needs its own dedicated outlet. If you do purchase one, make sure that it has something on it where if it does tip over for some reason, it shuts off automatically. Or I just heard on the news today, maybe have some sort of timer on it where you can't use it for 3 straight days. Okay, things like that. How did I get into this predicament in the first place? And through no fault of people, these things do happen. When we talk about fire safety, we talk about maybe carelessness with cigarettes. We've responded to many a fatal fire, and the cause was carelessness with cigarettes. And it doesn't matter where you live, where you come from, okay? It doesn't matter. It happens to everybody, but we have to be careful. We talk about safety with candles. A candle is a live flame. It's a live flame. Try to leave it at least 3 to 4 feet away from something combustible. Okay, anything combustible. Clothing, sheets, plants. Don't leave a live flame sitting on a table if you have a plant and maybe that plant is dried out. Even in a place of worship. One Sunday afternoon, I walked into my church and I saw all on the windowsills, all the plants, okay, during the holidays, but they were drying out. Unfortunately, somebody came up with the idea of leaving candles in between each plant. And those plants were drying out and they were leaving the windows open. And a little gust of wind coming from that window could blow one of those leaves off onto the candle itself. That could cause a problem. Okay. Also with candles, don't leave them unattended. Don't leave them on a table unattended, especially if you have small children. Or maybe a pet can knock it over. Okay. Extinguish it before you leave the room. These are some things we could do. Kitchen safety. Please don't leave something on your stove unattended. Okay, keep an eye on it. Try not to get distracted. Okay, if you have to put a kitchen timer in your pocket, something to let you know that you have something on the stove, do so. When we were finally able to go out into the public after COVID, it was nice. It was nice to see everybody. It was nice to go to community rooms and buildings. It was nice. And, I would tell people, I'd be able to demonstrate, some things that I can't demonstrate virtually. But, we try our best. We try our best. We talk about the importance of smoke detectors. Early detection Okay, early detection, where if it's a small smoke condition, at least you'll know about it. Okay, you can get yourself and your family out, call 911. Call 911. It might be a can job, but basically we're just going in there with a fire extinguisher to put it out. But if you didn't have a smoke detector, okay, now you're crawling on your hands and knees. You one hand on the wall, one hand on the floor, because all walls lead to windows and doors. Do we want to do that? No, we don't. Early detection. Okay, early detection will help us out. And it also helped the firefighters out. Would we rather go into an apartment with just extinguisher to just basically knock down a little fire inside of a waste paper basket? Or would we rather stretch 2 hose lines up a staircase, okay, where basically now it's fully involved? So it helps us out too. It helps us out too. If you choose, because not everybody will, if you choose to purchase your own extinguisher, make sure it's an ABC extinguisher. Category A, Category B, and Category C type of fires. Category A fires, ordinary combustibles, clothing, paper, wood. Category B, flammable liquids. Grease that you cook with is a flammable liquid. Fuel, it's a flammable liquid. Category C type of fires. Charged electrical equipment. Your toaster. If it's plugged in, it's charged. Okay. If it catches fire, maybe the wiring might be a little old, might be dried out, and it's still plugged in. Because in this ABC fire extinguisher, there's a dry powder in here. Okay, it's a dry powder. So we're not spraying a liquid on top of the fire. Okay, a grease fire, you do not want to introduce liquid into a grease fire. You could YouTube it if you want, and you can watch that splatter, okay, where it can burn you and it could hurt you. Okay. Electrical fires, you don't want to introduce liquid onto an electrical fire. For the obvious reasons, you get electrocuted. Okay, that's why it's a dry powder. It smothers the fire. It takes the oxygen component out of the fire. It takes the oxygen out of it. It smothers it. Same thing with cooking. So we'll demonstrate. We'll demonstrate the best we can over here, but at least over here, at least over there. Now, I have to handle that. Now, if this is filled with grease, or if this is a pot filled with water, you knock it over, it's going to land on somebody. It can land on some part of somebody's body. It can land on a small child. How many of you doctors work in New York Presbyterian where the burn center is? Show of hands. Okay? Yes. You've seen it. It's not only firefighters in there, it could be children. And it can be very devastating. Something could happen at a young age, and they'll still have the scars years later. So we have to be careful. We have to be careful as the adults to basically take care of the children to make sure they're safe. And someday they'll do the same for us when we're older. While you're cooking, try, if you can, always have a glove and a tight-fitting lid. Because if there is a grease fire, at least what you can do is, if it's small enough, just put the lid on top. It takes the oxygen component out of the fire. The fire loves oxygen. If not, with a gloved hand, sodium bicarbonate. Baking soda. That's what it is. Just sprinkle it on top. It'll smother the fire. And then safely turn off the gas. Okay, these are just some things you can do. But what I don't want anybody to do is pick up the lid, pick up the handle, and start running towards the sink. Because now you made a fire this big, this big. Because fire loves oxygen. Bless you. Fire loves oxygen. The more oxygen you feed it, the bigger it gets. Any questions so far?
Yeah, I have a question.
Yes, sir.
If the pot or pan is on the stove,
Mm-hmm.
which way should the handle be facing?
Facing in, not facing out. Because unfortunately, maybe a small child could hit into the handle, or even a pet. Okay, try to leave at least a 3-foot area of safety around that stove, if possible. I mean, you know, in some apartments, you know, a 3-foot area of safety from the stove could be your next door neighbor's apartment. You know, I mean, unfortunately, that's the world we live in. But try to leave an area of safety around the stove. Okay, so we don't want anybody getting burned. Okay, going on. When it comes to cigarette smoking, like I just mentioned before, like I said, it doesn't matter where, you know, where you live, what your family dynamic is. I mean, we had a fatal fire about, I'd say about 3-4 years ago, right off of Sutton Place, unfortunately. And these things happen. These things happen. You know, and cigarette smoking is like one of the toughest habits to break. I mean, really, I mean, growing up in the 60s, you saw, you know, the commercials on, you know, they're selling cigarettes. And then right after that is, you know, is the whiskey commercial and, the cigarette commercial. You're showing the cowboy riding in the desert, you know, he's on the horse and he's got the cigarette, you know, and, you know, basically that's how it was. That's how, but it's one of the toughest habits to break. So if somebody does smoke in your home, please tell, you know, I mean, I don't mean to sound, you know, to sound rough, but like, please ask them to smoke outside. You know, I mean, I don't, you know, in a polite way, don't just show them the door. But please, don't, if they do smoke, please don't smoke while you're laying down, especially if you're watching TV and you're watching something boring and you fall asleep, or if you're imbibing in some sort of alcoholic beverage, or if you're taking some sort of medication that makes you drowsy. Okay, please, if you have to smoke, smoke outside. Now, if you're living with somebody, or even yourself, that they need supplemental oxygen, please don't smoke in the same room, because oxygen is an accelerant. Okay, it's an accelerant. And believe it or not, with that little tip on the tip on that cigarette, okay, with that accelerant can cause a fire. Okay, so we don't want that to happen to anybody. Okay. Like I said, candles, there are safer alternatives. Battery operated candles, and they have a scent. They're nice. Okay, they're nice. But if you do choose to purchase a real candle, make sure it's in a sturdy holder. Okay, make sure it's in a sturdy holder. And like I said, don't leave it unattended. Okay, because unfortunately, tragedies can happen with an unattended candle or a candle that falls over. Now, I was talking about my space heater. Okay, this little thing. Okay, it's still an appliance. Okay, it's an appliance, just like in the summer. An air conditioner is an appliance also. All right. This has to be plugged in directly into the wall. Okay, directly, it needs its own dedicated outlet. There can't be an extension cord in between. Okay, because as small as this is, it draws a lot of wattage, a lot of out of the wall. Okay, and now the cord is going to get hot. The extension cord also is going to get hot. Okay, we can't use an extension cord. We need it to be directly into the wall. And obviously, same thing with the major appliance also, refrigerators, stoves, washing machines, anything of that sort. And unfortunately, a lot of these things, a lot of these appliances were invented not that long ago compared to how old the building is. Okay, so you might not have enough outlets in your home to plug all these things in. Okay, unfortunately, maybe some of these buildings could be over 100 years old. Maybe the refrigerator wasn't even invented yet. Maybe they had an ice box. Okay. Unfortunately, or fortunately, depending on how you want to look at it, in some of these buildings, the wiring may have to be upgraded. I know with the Department of Buildings, I believe if you basically upgrade your home, like maybe build an extension or you go up like a private house, and then when our friends from the Department of Buildings come and they do an inspection in your home, they basically want an outlet on each room. I mean, in each room, on each wall. Okay, so that's upgrading your electrical, all right, for safety reasons. They're the experts, especially the electrical division. They also have a plumbing division also. They're the experts, okay. Plus, they basically want a working smoke detector within 15 feet of your sleeping area. Okay, within 15 feet of your sleeping area. But on top of that, nationally, it's recommended that you have one in each bedroom also. Okay, so if for any reason we need smoke detectors in our homes, we have a great program called Sound the Alarm Program. Okay, now don't keep this information to yourself. Let everybody know. Okay, it started out as a program basically for the elderly because we would go to their homes. Basically, retired firefighters would go to their homes and install them, basically to the elderly, because we didn't want an elderly person purchasing one because they are kind of expensive, and also stepping on a step ladder where they may fall and hurt themselves. So that's how we started out. But you want to know something? Let's keep everybody safe. So I'll give one person the number, and if somebody wants to just basically take it down and give it out to everybody, that'd be a great thing. Okay. We were working in conjunction in partnership with the American Red Cross. So that's how the Red Cross gets involved with this also. So the name of the program is Sound the Alarm Program. And the number is 1-877 Red Cross. Just leave off the last S. So it's 1-877 RED CROS. Just leave off the last S. Give them a call, leave your information, and they'll get back to you. They'll show up with a little white van that says FDNY on it. And basically we'll bring the smoke detectors with us. Okay, it has, basically, you don't have to replace the battery anymore. It has a 10-year lithium battery inside of it. Okay, where you just basically change, every 10 years, you just basically change it. And it'll indicate to you when it's time to get changed, because it'll chirp once. Okay, it'll chirp once and it'll let you know it's time to change the whole smoke detector. Okay. It's a great program. Doesn't matter how big your apartment is, how big your home is. We'll evaluate how many you need, and we will bring them and we will install them. And everything is for free. It's all for free. Even if you have them. Okay, you went out and purchased them maybe close to 10 years ago. You have an older one. Okay, we'll take a look at it and we'll replace it. You know, we'll say you want, yeah, you need one up there. You maybe need one over here. You need one by the stairs. You need one in the bedroom. The one over there might be a little on the shaky side. Maybe it's close to 10 years old. We'll replace it and everything's for free. Okay, anywhere in the city of New York. Now, I don't know if the surrounding counties, they may have the same program, but we're more worried about the city of New York right now. Okay, so like I said, even if you have smoke detectors in your home and you're good, if you know anybody that needs them, you know, an elderly parent, an aunt or uncle, anybody, let them know. It's a great program. It's a great program. Okay. Now, what I have in my hands here is basically a glorified extension cord. Okay. It's a glorified extension cord. You can use it. All right. Basically, it's on everybody's workstation. All right. But make sure every once in a while, take a look at it. Make sure it's not discolored. Make sure you don't smell an electrical smell coming out of it. Make sure that the outlet that it's plugged into isn't discolored. Okay, where it has a nice white plate on, all of a sudden it's starting to turn yellow. You might have something going on in back of the wall. Okay, maybe there's too many things plugged into it. It does happen. So we have to be careful. Like I always say, if your outlet has 2 plugs, try not to make it 6. Okay, 6 different things plugged into that. Don't piggyback on each other. It can cause a fire in back of the wall. So we have to be careful with that. That's part of prevention. That's part of prevention. Any questions so far, what I've just gone over? Anything?
Yes,
Yes.
yes.
Go ahead. Go
I
ahead.
hear
Anyway,
you.
Go right
I
ahead,
hear you.
Cynthia.
so this is Cynthia Tibbs.
Hi, Cynthia.
So yeah, my building had a fire a week and a half ago, and I
Mhm.
want to talk about prevention because I live in a pre-war building that was built in 1889.
Yeah.
And all we have are sprinklers. Now, the fire was caused from a space heater, not because we didn't have heat, but because we had an 89-year-old tenant who wanted to wash his walls and thought he could dry them quicker
Oh,
by
for
using
crying
a
out
space
loud.
heat. Okay, so
Oh,
when
boy.
that happened and the heater caught fire, and then he had a 15-year-old fire extinguisher that he hadn't checked to see if it was still any good, and that didn't work. He threw a
Yeah.
wet towel over it and it exploded. Now, we have smoke detectors in our apartment, and they are over our bedrooms, but the way they are situated, and in the age of COVID that I caught last March and never got my sense of smell back, by the time my smoke alarm went off, I was already cornered off in my bedroom and couldn't get out. So I have been talking to anyone who listened to me that we need to have smoke detectors put in our stairwells. because the sprinklers never went off, because the fire never melted the little wax things to
Right.
make the sprinklers go off. So if we want to talk about prevention, I don't see why I can't get FDNY to do an inspection of my buildings and make a suggestion to NYCHA that it would be in everyone's benefit, since we want to keep everybody safe, that please give us smoke detectors in the public space areas. It's not like I'm asking for much, it's to save a life. And during the age of COVID, when a lot of us don't get our sense of smell back, we shouldn't have to wait for our detectors to go off in these buildings that are run like railroads, and our doors are trapped off and we can't get out.
Okay,
Well, what we could do is basically, now, you want the detector in the hallway.
Yeah, we are walk up. So it's a one person on the stair at a time. The steps are very narrow. We are walk ups. We do not have elevators. Our only means of getting out of here are the stairs out of the building. So if that's our only.
And the sprinklers are in lieu of
Stairs.
instead of the fire escapes. That's how they got away with that.
Exactly. We don't have
That's
fire
how-
escapes.
That's how they got away with that, because sprinklers are in lieu of fire escapes.
Right. So it would just make sense. And I don't see why I have to get so much pushback that it says that, oh, well, the building's up to code as long as we provide, the smoke alarms for the apartments. I don't
Right.
see why it's not $1 billion. It's not even $1 million to put these things in the public space area with the direction of FDNY to suggest where they could go. And also FDNY also fines NYCHA for, safety codes, whether it's people who's got their bicycles in the hallway or their mats in the hallway or strollers in the hallway. They should be fining the tenants, not NYCHA. Then the tenants would stop
Yeah.
doing it.
okay,
Yeah, that's,
okay. Is there any situation that you know of where there are smoke detectors in hallways?
They are in the new buildings. I've checked.
Uh-huh.
They're in all the new walk-ups. They have them, but we don't, because we're pre-war.
Okay, I hear you. Okay,
we're gonna have the local firehouse basically take a walk over there, or take a ride over there, do an inspection, and then send an A8 referral to the Department of Buildings. And then they're gonna have to go over there and make the suggestions that you're saying. But
Okay.
it's basically we could just, like I said, from one city agency to another, we can make a lot of suggestions.
Good evening, everyone. This is Sandra Sanchez, Community Affairs.
hi, Sandra.
Yes. Hello, Cynthia. I know.
I'm not going to stop talking about it until I get my way.
Well, it's not a problem, but I also want to assure you, for those who may not have been in our meeting that we had last week, we're working on it. We are a city agency after all. We are working on it, and everything that I said that we would do to work as Captain Delegati alluded to get an inspection. We are working on that. So what I applaud you for continuing to advocate not only for your safety, but also for that of your neighbors. But we are certainly in the midst of working on it, because we too want all New Yorkers to be safe.
And
Okay,
Cynthia, this is Maxwell Vandervliet, the Assistant District Manager. I'm just gonna jump in and say that after Sandra's recommendation the other day in our meeting, I did reach out to HPD since she did say they have jurisdiction, and I'm currently waiting to hear back.
okay,
I have Shirley, I have a question for the
go
captain.
ahead. And then
Actually,
Richard.
Can I just chime in also? A lot of unfortunately, we respond after a tragedy. And a lot of laws have to be changed. And it's not only for the tenants, it's also for the firefighters' safety also. It also helps us also. It's in our best interest also to, because, we all want to go home at night also.
Mhm.
So as So we all have to work together, okay? Work together with all the city agencies to try to keep us all safe.
Okay.
It's in other words, as a fire captain in my own firehouse, my job is to keep myself and my members safe when we go into an emergency situation. And we want as many things as humanly possible that could have been done to keep us safe while we're going in there, to keep maybe a fire at a minimum. Okay, it might sound selfish to you, but it's just something that we do, that I want to do, because I want to keep myself and I want to make sure that my members are able to go home to their families also. And we also want to make sure that the tenants are safe also. So whatever we could do, if we could change some laws, if there are things that it could be done differently, that'd be a great thing.
Okay. Robert, Richard?
Yeah, thank you. Captain, I have two questions. One is that for a time, the combo smoke and seal detectors was recommended. And you're talking about the smoke detectors now. Is it still recommended that the combo units be installed?
Yes.
Just the smoke?
No, we should have at least one carbon monoxide detector on each floor of your home, depending on what type of home you live in. Okay.
Yeah. Okay.
But at least one. Now, it can be its own carbon monoxide detector, or it could also, this is a combo itself. The one I'm holding up here.
Yeah.
Right.
Right.
This is a combo itself. So either it could be on its own as a carbon monoxide, or a combination carbon monoxide / smoke detector.
Right.
Okay?
Yeah,
because unfortunately, carbon monoxide is a silent killer.
Yeah, right.
Absolutely.
And it is slightly lighter than air also.
Right.
It's slightly lighter than air. And if you live in a private home, and now in your basement, you have your boiler.
Right.
And your hot water heater. Both of these things do emit a little bit of carbon monoxide. Okay, it does emit a little bit, but the piping or the flue of the boiler or the hot water heater is supposed to be channeled into a chimney.
Right.
Okay, so now it goes into the chimney, and now if that chimney is clogged, like I said, the carbon monoxide is slightly lighter than air, exactly like you just motioned. It'll go back into your living space.
Right.
And it could rise.
Right.
Okay, and like I said, it can be the silent killer because you don't see it, smell it, and you feel a little drowsy, especially in the wintertime where everything's all closed up, and then you could pass out. And then, of course, it could be fatal. Just like a fire can happen, say, in your basement or on a lower floor. Okay. In the smoke is carbon monoxide. Okay.
Yeah.
And that's what causes the smoke inhalation.
Okay.
That's what causes the smoke inhalation. It's not, usually with the fatalities, it's not the flame itself that the person, I mean, I hate to be blunt about it, but the flame itself that killed the person, it's the smoke.
Right.
And the inhalation of the smoke. And that's when we talk about planning. Fire drills at home, like we tell the kids in school, you have fire drills in school, you have fire drills at home. Okay, and to know what type of building that you live in. Okay, know what type of building that you live in. If it's supposed to be told to you or given to you, like on either on the lease or the condominium, whatever, by the management company, by the landlord, by the super, of what type of building that you live in. Is it a fireproof multiple dwelling? Is it a non-fireproof multiple dwelling? Okay, you're supposed to have it's supposed to be given to you a fire plan of what to do. Okay, now, obviously, fire is in your apartment. Get out. Get out. But depending on what type of building that you live in, if you live in a combustible, non-fireproof multiple dwelling where fire can spread from one apartment to another within minutes, okay, you can't shelter in place.
Right.
You cannot shelter in place. Okay, you may have to. Okay, even if fire is not in here, you'll have to get out. And when you get to your apartment door, open it up so slightly. And if you see in the hallway that there's smoke or flame, don't go out into that hallway. Use your fire escape. But please don't block your fire escape. Don't leave it padlocked. All right, because maybe during the day, and when it's all lit, yeah, you can find the key and open it up. But trust me, in a smoke-filled environment, you are not going to be able to see, and you are not going to be able to get to that key to open it up. And please don't leave anything on that fire escape where, all right, maybe you can get out, but how about the people above you? They're trying to get down a fire escape, but there's a planter sitting there, and somebody can trip over it and hurt them, and they can fall, especially in that type of situation.
Okay.
When you get out, if you do choose, if you can go out down into the hallway, never use an elevator.
Right.
Never use an elevator, because an elevator is basically electronic box inside of an elevator shaft, which is a chimney. Smoke can get into that elevator shaft, rise, and then you can get trapped in that elevator. You can get trapped in that elevator. So please, never use an elevator. Okay.
Shelley,
Now,
I need to round off.
but let me just talk about, because unfortunately, let me just talk about non-combustible buildings. Okay, fireproof multiple dwellings. All right, fireproof multiple dwellings. If the fire is in your apartment, okay, try your best to get out. Okay, if it's in your butt, with any type of building that you live in, please close the door. Okay, close the door, or hopefully there's a mechanism where the door closes automatically. Okay, self-closing door.
Right.
To keep the smoke and the heat from going out into the hallway.
Right.
Especially if you live on an upper floor, and say if you live on an upper floor on a high-rise multiple dwelling that's facing the water. Now, the heat takes out the windows of that multiple dwelling. Now the wind condition comes into that apartment, blows the smoke and the heat out into the hallway. Okay? That's why the fire department suggests, if you live in a non-combustible building, fireproof multiple dwelling, okay, where we could find out if we live in one by basically calling the buildings department 311, give them our address, and they'll tell you what type of construction that the building is made out of, okay? Because what we don't want to happen is, we don't want somebody to come that basically who could have just sheltered in place, all right? Taking some towels and put it underneath the door if smoke was emanating into their apartment. Well, we don't want somebody that could have sheltered in place coming down the stairs and getting trapped in a staircase. Because the smoke and the heat went down the hallway and up the stairs. That's why it's so important for all these buildings to have self-closing doors. Okay, to keep the heat and the smoke, especially the smoke and the heat, out of some of these staircases. Because not only will it help the tenants, it'll help us when we're going in there to fight the fire. Especially if it's a standpipe situation. If that staircase has a standpipe in it, guess what we have to use to put the fire out? We have to use the standpipe. And I really don't feel like sending myself and my members into a staircase that's filled with smoke to find a standpipe outlet to stretch up to the fire department.
Right.
Hopefully that answers your question.
Well, yeah, great. So, Cynthia touched on what's characteristic in brownstones, of course, but in the Bronx, you have all of
Yeah,
these,
brownstones,
you
yeah.
have these row houses, and they've all got the sprinklers, no fire escape. Now, would an adept homeowner be able to upgrade to maintain that sprinkler system adequately, or do they need licensed plumbers to inspect the sprinkler system every year? And is that code? I don't recall if that's code or not.
I don't think it is code yet, but they're working on it.
And
They're working on it, but you really want, it's kind of like the same thing. You really want a plumber to take a look at it, somebody that's actually licensed, that's, I hate to say it like this, that actually knows what they're doing.
Oh, yeah.
Okay, that's like having somebody working on your home, and they may know, that they may be installing new outlets into your home, but if they don't have a license, unfortunately, I mean, they may know what they're doing, but they just need that piece of paper. They need that
Okay.
piece. So they're probably gonna be looking for a licensed plumber to take care of something like that.
So we're going to move on to two more questions, one from Rich and one from Paul. Oh, and that third one, and from Ira. Rich?
Yeah, thank you very much. And thank you for doing what you're doing. What you mentioned about the Sound the Alarm program where people can get free smoke detectors, I wasn't aware of such an efficient program. I think someone had mentioned it in one of our previous meetings, but this seems really newsworthy. And I'm wondering what more can be done to promote this. Have you looked at promoting it on the Link NYC devices that are all over the Upper West Side and all over the city, just to let people know that they can get these? Also, have you talked to local newspapers like the West Side Rag to try to get them to promote the story? Because depending on how much capacity you have, I'd imagine there's basically unlimited demand for free smoke detectors.
Well, maybe if they want to promote it more, we can wait till after we all get it.
Now, there's plenty to go around. There's plenty to go around. We have basically our Deputy Director of Community Affairs for the FDNY on the phone in the other room, but I believe Sandra is still with us, and I believe that's her forte also, so she could probably answer how we can get away with, not get away with, how we can do something like that.
Yeah.
Yes.
Sandra? Yeah.
Yes, I am still here. That is on the table for partnership. Richard Robbins, I think that's a great idea that we've thought about it, to already use a marketing tool that's already available, that's at our disposal as a city agency. And we certainly have worked with smaller community magazines, but if there's a contact that you'd particularly like us to reach out to, please feel free to share. And if they're willing to promote that tidbit, certainly as it is winter and that's peak fire season, we will be happy to do so.
Great. Okay. Paul? Unmute. You have to unmute.
Got it?
Yeah,
Hello?
that's it. Good.
Hi. I believe that inspections and enforcement, along with information, might have saved lives at that fire up in the Bronx. Am I wrong?
Oh, you're not wrong. You're not wrong at all.
So why don't we do this? Why don't we have more inspections at buildings like that? It's an older building with multiple people living in multiple apartments, and if anything needed inspection, that was a place that did. My heart breaks for those kids that died there.
Yeah.
Yep. Okay.
That's all I got.
Got it.
And that's a great point. Thank you, Paul. I mean, it really does. I mean, the neighbors, obviously they saw what was going on, but the responding firefighters that were there, and basically it was heartbreaking what they saw with, they were basically call, there was so many victims where they had to get them transported as fast as possible. And they were basically calling out for any ambulance to show up to help transport the victims. And you felt helpless. You're there, getting people out of the building and extinguishing the fire, but that's all you could do after that. It was horrifying.
Yep.
It was horrifying.
Okay, Ira?
Yeah, I wanted to say a couple of things. There is a requirement that the owner of a building send an annual notice out to each resident, tells you building's combustible, non-combustible, how you exit, so forth and so forth. It may look like a piece of junk mail, but it is required and it is worth reading. And it would give, it gives everybody the information. The other thing is that in regards to the small sprinkler systems, FDNY does issue certificate of fitnesses that are required to do monthly inspections of small or larger sprinkler systems. And and all the little brownstones around here are supposed to have people who have the certificates of fitness. You get a nice picture with your photo on it, and you take a test. It takes about an hour. And that's a requirement. And whether that's enforced or not is another issue. And then, of course, as you get to larger buildings, you are required to have certificates of fitness for the fire standpipe and so forth and so forth. So there is a process. And those are relatively easy exams to pass if you have some experience in the trades. Whether it helps people like Robert was mentioning who might have a 2 or 3 family house in the Bronx, I don't know if all those folks have the basic experience in the trades, but most people who are maintaining the buildings, the small buildings that we have on the Upper West Side, should be able to understand how a sprinkler system works, pass it, do the monthly inspections to make sure that the systems operate. So check around, find out if you've got one of those systems and ask.
Yeah, thank you, Ira. That's really good to know.
Basically, can I just chime in for a second?
Yeah.
We discussed about the distribution of that fire safety plan. That's basically that's handed out to the residents and stuff. Is there any way? I mean, I know we can't cover all the languages, but maybe unfortunately there might be a language barrier, with some of the residents where, they don't understand it. They just don't understand it. If it was explained to them in their native language of what to do, maybe that could have saved a lot of lives also.
Mm-hmm.
Well, yeah.
I mean, Sandra could also probably attest to this also with the fire safety, FDNY fire safety education. If you go on to FDNY Smart, okay, FDNY Smart, we do have pamphlets in as many languages as we could think of where somebody could download it, or if somebody doesn't own a computer, somebody could download it for them. Okay, maybe a parent, or maybe for a parent or an elderly parent or for an aunt or uncle, anybody in their native language, okay? So at least they could read it over. They feel comfortable reading it over. And it's not just in, 1 or 2 languages, it's all different languages. And I think that would help out a lot. It really will.
I mean, as a parent in New York City schools, we get things in about anywhere from 12 to 20 different languages. So that's certainly
good.
Yeah.
But, yeah.
But it's good to know they're available.
Such a diverse city, we should.
Yep.
Well, it's really an important point also, because in the case of Twin Parks, which is the residency is significantly African, in this case, Gambia, you have a core of teenagers, all of whom speak English, they're school kids. And that would be a wonderful suggestion, Captain, for that be one of the tasks of these teams that are working on fire safety issues, that they conduct classes, they can go into the building, or the residents can go to the community center locally. And I know of particular organizations that I'm affiliated with in the Bronx that would provide that same service. So I think that's a
Yeah,
I don't know, Shelley, we can work on that, Shelley.
Sure, sure.
Even if we spoke, at least they could interpret for us.
Yes, indeed,
Right.
absolutely.
Right.
Even if they can, they don't have to just give the credit. She'll show up and they can interpret for us if
Yeah.
need be.
Yes,
And-
indeed.
And
Yeah.
even on a smaller level and not as extensively, every community has a CERT team. So, and we
Yep.
were all up at the Bronx Fire Recovery Center, and we had people who spoke every language under the sun. On our own team, local team, we have 3 or 4 languages spoken, okay, which are common to our area. And I'd like to promote that too. We can have, the fire department do this great educational stuff. If people need something in their building for their tenants organization or in the community center, we do it 2 or 3 monthly. Now, the key point there is that people have to ask for it. What we found is about 95% of the people have no idea what to do if there was a fire in their high rise, in their low rise, in whether it be in NYCHA, whether it be in co-ops. They don't know they can't answer the first question correctly. And there's something wrong with the education overall, okay? In school, there should be these educational things in community centers. We won't do it tonight, but one thing we may come up with is a recommendation to the city, as we did with COVID, that they have public service announcements where they can handle kitchen fires. They can handle what to do if you need to escape your apartment, close the door. We had them years ago. And,
Yeah.
there's no reason why public service announcements, they can be on yellow cabs on those screens instead of all the craziness they have on it. And other places. There could be, there's so many opportunities today with technology to get that information out.
If we could,
Mhm.
because I know on FD1 Spot, we do have the videos for the children and also for the adults. But if there's any way that we could show those videos, or maybe on the major net, like the regular networks, like channel 2,
Sure.
4, 7, something, where if you don't have cable TV, okay, something where, the ordinary person, basically instead of watching one thing, they can watch like videos on fire safety.
Yeah, and they're really good.
That would be a great thing, but
Yeah.
but you have to have it in all different languages also.
Okay.
That's maybe on channel 41 or 47 or something. All the other different channels.
Okay, that's something else we can advocate for. We need to be able to educate as many people. If my experience is that almost all people don't know what to do, can't answer the basic questions easily or not at all, then we're in trouble in terms of safety. And that's why things are happening. I think a lot of what Captain Delgado reviewed with us tonight are the key things that could affect us in our home. And I think that's very, very important. We're going to try to get these information into minutes and maybe into a document so that we can put it on a website and try to promote it too. Tips, fire protection tips and so on.
Because we always talk about, even with the children, don't hide, go outside. And unfortunately, there's been fatalities where, unfortunately people were, they went into their bathroom and they went into the bathtub and they filled it up with water and they're holding their grandchild. Well, like I said, it's not the flames, it's the smoke inhalation, it's the smoke that's filled with the carbon monoxide.
Mm-hmm.
We tell the children, don't go into a closet and hide. Okay, don't hide, go outside, don't open up a hot door. We, like I said, before COVID, we would bring the smoke houses to the elementary schools that asked for it.
Mm-hmm.
And for a week, we would teach the children on prevention and what to do. And then on a Friday at the end, we would bring that smokehouse to that school, and then we would fill it up with fake smoke, Hollywood smoke, and we would demonstrate to them on how to stay down, how to stay low, get to a wall, crawl with your hand on a wall. In one of our smokehouses, we have an element behind the door which makes the door warm. It makes it hot. We tell them, do not open up a hot door. You have to find another way to get out. Then they keep going down that hallway. There's actually a window with a radiator, okay? It's basically situational awareness where know where every window is in your home. Okay, if there's a radiator, more than likely the radiator is below a window. Okay, so know where that window is. Then keep going down that hallway. Get to the last door. Feel the door with the back of your hand. Okay, if it's cold, we could open up that door. If it's hot to the touch, we may have to rethink on basically part of our plan, or maybe we have to go back to that window. Okay, we might have to use the window, and hopefully there's a fire escape there. That's what we teach. That's what we try to teach the children.
That's
Maybe
great stuff.
Maybe we should start teaching the adults too.
Yep.
I mean, other than stop, drop, and roll, we try to teach the children,
Right.
things like that. Stay low and go, and don't hide, go outside.
Okay. Thank you so very, very much. I think, this was great.
You're
Captain
welcome.
Delgado, thank you,
My
Sandra.
pleasure.
We are so appreciative.
My
And the
pleasure.
community is too.
Unfortunately, right now, I can't, be full-time at fire safety because unfortunately, we're kind of understaffed out in the field. So, we have to, wear a couple of different hats, and help out as much as that we can.
Captain, just thank you so much.
You're welcome. You're
We
welcome.
appreciate it.
Stay
Okay,
safe, everybody.
thank you.
You're
You
welcome.
too. Okay, we welcome, yeah.
Excellent, Shelley. Excellent, Shelley.
Yeah, I think this is very important. We should spread the word, have discussions where we can. But I
Yeah.
think we need to go further and we need to use the media because if people, we're reaching a certain number of people and it's a danger. Having been for 2 weeks up in the Bronx, if the one apartment door had been closed,
Yeah.
and no one would have died. One apartment or maybe two or three may have been damaged. And most of the people do not want to return there because of the trauma. So, and the firemen put their lives in danger because when they got further up, they didn't have any more oxygen to feed them, to keep them going. And they were in the black smoke with these, putting themselves in danger of asphyxiation. But they went up and they rescued people. Amazing. They did an amazing job. But we don't want to have to depend on our fighters putting their lives in danger if we can avoid the fires and the effects of the fires at a low level. And really, that's what we should be working at. Okay. So if there is a motion to adjourn.
What? What? No way.
I just,
Shelley, I just want to make sure that that we also talk about the agenda for next month.
Okay, good.
Yeah,
Okay.
just mention that, and then Ira, if you have a comment, I didn't mean to interrupt you.
I just have one, sorry.
Catherine, go ahead.
So next month, we had some fantastic ideas that Madge forwarded to us to do with mental health. And so we are going to focus our meeting next month on mental health. And Shelley and I came up with a title today, draft title, which Shelley, do you want to share that?
Sure. New initiatives to support mental health in the community.
Yeah, there's like a lot of good work and good ideas out there for improving mental health as a part of public health. So if you have any ideas, we're going to start to reach out to folks in the next week. So if you have ideas, please let us know.
And we're going to advocate those good ideas to our city council. We have support there. There are people involved with it already. They may come to the meeting if we can get them. And so it's not just going to be an interesting evening, it's going to be an evening with actionable things that come from it and leads to advocacy. So we're
Yes.
excited. We're excited.
Yes. There's people that are doing really good. There's our leaders in the community are doing really good work, and there's a lot of really good initiatives that are happening. And so that's why we're focusing on new initiatives and figuring out how we can support those action items.
Yeah.
So we're excited for that, and we'd love to hear any ideas from you. And Ira, I'm so sorry that I cut you off before.
Sorry.
You
But I'd love to hear what you have to
get
say.
the last word. You see?
I just want to remind everybody, I think all of us, or many of us have been in the inside Community Board 7 since 1998. If you haven't, you're excused for not remembering a similar tragic event, which has the identical path of the fire in the Bronx, though 4 people died in CB7. It was Macaulay Culkin's family in the high 60s. Same thing. Apartment doors were left open. The people went into the fire stair. They inhaled the smoke and they died. And this touched off a whole series of fire safety initiatives by the city, such as sprinklering high-rise buildings, and some of the notices that we see today on the inside of apartment doors and mailed. And this is all 22 years ago. So we really need to do continuing outreach year in, year out. Not every time there is a tragic fire where multiple people perish in it, and we wait for another generation when nobody remembers. So if anybody doesn't remember the fire, go check it out. It's very, very similar. It's the same issues over and over again. Fire doesn't learn anything new, and I guess we don't either. That's it.
Okay.
Shelley, one more thing. There's an attendee that has their hand up.
Okay, good.
Mention that. Thank you, Doug, for pointing that out.
Heather?
Oh, yes, I posted my question in the comments. I'm not sure if you saw it. I was recommended that I join this meeting because I'm seeking information about the shelter project that's proposed for 537 West 59th Street. Could you share any information that you have and any community impact report information that you have with the public, please?
Sure. It's we haven't gotten the full set of information. It was evolving. It was a plan to be a women's shelter.
Okay.
Okay. And the actual numbers, we did have one meeting and they came up with some numbers, but they weren't certain. We suggested the numbers be reduced to guarantee more effective service to the people. But it's in the building that either has or is now still housing the Manhattan Cable, programs. But we haven't heard anything in maybe a year. It's something we can look into and get back with more information on.
Okay, so you don't know who
Mark,
owns.
do you have anything to say?
I just wanted to throw in everything you said is what I know too, Shelley. In fact, you probably know more because you were at that meeting. But I do know that I recall anyway that our now council member, Gail Brewer, who is the council person for that footprint. I think even with redistricting, it'll still be her district. Has suggested alternative uses for that space along the lines of supportive housing, permanent housing, as opposed to a shelter.
Mm-hmm.
With the change of mayoral administration, it may be a time to revisit that with the new leadership. And obviously, I believe the sale has closed. But as Shelley says, just because the sale closes doesn't mean that the occupancy ends right away. But anyway, that might be a useful thing to keep in the back of your mind as we're all thinking about what's the best use for the benefit of the community for that space.
Okay,
Yeah, and
so it's not confirmed that it will be a MICA population. Everything is still in the works.
exactly. And,
Okay.
we will check into it, but, Gail's suggestion in general, the difference between having a shelter, okay, and having a permanent affordable housing, for many populations is just a hop, skip, and a jump. We saw the population on 107th Street develop, and with supportive services, it could have been permanent housing. We met the woman in that woman from the many women from that women's shelter. You're just wondering why they were in shelters still. Why didn't they convert that to permanent housing? So, the theory in past 20, 30 years is you have to go in different stages, and there is validity to that. Not everyone can adjust to permanent housing, even with supportive services right away, but a lot of people can. And better give more services and have permanent housing than put people through a transition that can take years. So I'm glad you brought it up. We'll look into it. If we get some information, we'll be able to report back something more definitive. But thank you for raising it.
Okay, thank you.
Okay. So,
Just to clarify, Shelley, and correct me if I'm wrong, what we heard was that there is a plan for a shelter, and we don't know what the status is right now. Is that correct?
Exactly.
Okay. So we can find out information about that and maybe share it next month as well.
Sure.
Or sooner. So, okay.
Okay. Motion to adjourn. Okay.
Good night.
All in favor? Okay. Take care. Have a good night. Stay safe.